Order. Order. Before we begin, can I encourage members to wear masks when they are not speaking? This is in line with current government guidance and that of the House of Commons Commission. Please also give each other and members of staff space when seated and when entering and leaving the room. I now call Bell Ribeiro-Addy to move the motion.
And might I say what a pleasure it is to serve under your chairmanship. I'm thankful that we're able to have this debate today, which actually follows from an e-petition debate which was held in April. After receiving over 180,000 signatures, MPs were given the opportunity for the first time to debate a petition calling for improvements to maternal mortality rates and healthcare for black women in the UK. I'd also like to take this opportunity to thank Tanuke and Chloe from 5 Times More, as well as Elsie Gale, whose tireless campaigning efforts have forced this issue onto the agenda and has not only provided us with the opportunity to discuss this issue, but has also given a voice to many black women who have experienced a traumatic pregnancy or birth and those families who have lost loved ones. For too long, the statistics had pointed towards a glaring disparity in black maternal health experiences, and for too long, nothing was said. We now have a Black Maternal Health Awareness Week, where we can contribute to highlight the disparities and discuss ways in which we can make pregnancy a safe experience for all, regardless of the colour of their skin. Members will by now be very familiar with the statistics surrounding black maternal health care and mortality, but they bear repeating because in the UK, which is one of the safest countries in the world to give birth, black women are still 4 times more likely to die in pregnancy or childbirth. Black women are up to 83% more likely to suffer a near miss during pregnancy. Black babies have a 121% increased risk for stillbirth and a 50% increased risk of neonatal death. Miscarriage rates are 40% higher in black women, and black ethnicity is regarded as a risk factor for miscarriage. Black mothers are twice as likely to give birth before 37 weeks of pregnancy. The situation for women and birthing people of mixed heritage and of Asian heritage, unfortunately, is not much better, with those of mixed heritage being 3 times more likely to die in pregnancy and childbirth, and Asian women 2 times more likely. Asian babies also have a 55% increased risk for stillbirth and a 66% increased risk for neonatal mortality. But we all know that racial disparities in health did not begin and certainly do not end there. Yet despite these statistics, despite the number of reports and studies that have been produced in the last year and before this, despite being aware of the glaring disparities in maternal health care, we still have no target to end this.
Are very, very alarming and particularly disconcerting. That black ladies are 4 times more likely to die in childbirth is shocking. Does she agree that there is, I believe now, a responsibility on government and on our minister as well to outline the steps to address this most urgently? Because you're going to outline the issues, but we want to see what the response will be to make it better.
Ribeiro-Addy.
Thank you very much, and the honourable member is absolutely right. With disparities such as these and no clear way forward, that's what we're hoping to hear from the government today, because with all of this information we have, it's clear that the response is not good enough. Now, in the USA, where there is also a glaring disparity in maternal health outcomes of black and ethnic minority women, the government has actually begun to take steps to address this. In April, the White House issued its first ever proclamation on black maternal health. President Joe Biden declared a Black Maternal Health Week to take place annually from the 11th to the 17th of April. Excuse me.
I'm grateful to the Honourable Lady for giving way, and she's giving a very powerful and important speech. I wonder if she's aware that research from the USA shows that when black and Asian women don't have pre-existing medical conditions, they do have English as their first language, and they come from middle-class backgrounds, they still have worse outcomes compared to comparable white women. So does she agree with me that there is something more going on here, and that makes it all the more pressing that this government here understand and act?
for a very timely intervention. And also because she's absolutely right, and that shows that it's clearly about racism, and it's important that we look to what other countries who also clearly have issues with racism are doing to tackle this. Now, alongside this Black Maternal Health Week proclaimed by the White House, the Biden-Harris administration has actually outlined several action plans which specifically look at addressing the maternal health issues. Through the American Rescue Plan, $30 million has been reserved for implicit bias training for healthcare providers, and a provision which would allow states to expand postpartum Medicaid coverage from 60 days to a full year. But how has our government responded in comparison? In response to a question I asked of one of our equality ministers, I was told that there was no target because the numbers were not high enough. How has our government responded? Well, with a poorly rolled out plans which actually exacerbate the issue, I think by ignoring the problem altogether. Now, the NHS long-term plan aimed at providing continuity care for women across the country on paper seemed like a really good starting point to improve maternal health outcomes. However, in reality, as one whistleblower at Worcester Royal Hospital has said, it's created a two-tier system for pregnant women. To create the new team of continuity carers, midwives have actually had to be pulled from the hospital's core staff, leaving the hospital unit without enough specifically trained staff. Now, often...
Thank you, Mr. Chairman. A constituent of mine, Jade Sullivan, has been in touch with me to share her own experiences regarding disparities in maternal care and outcomes for black women. Her testimony was incredibly powerful, and I hope that I will be able to meet the Minister soon to discuss that in more detail. But does my honourable friend, the honourable member, also my friend, I hope, agree with me that we do need a clear plan with targets to reduce disparities in maternal health outcomes that actually outline the specific actions needed to improve safety for black mothers and their babies?
Ribeiro-Addy.
I just thank the honourable member because I do absolutely agree that is what we need, but we also need to make sure that these are well thought out and that they're well resourced. Because as this whistleblower from Worcester pointed out, often with this new plan, the ward could end up being short of 5 or 6 midwives per shift. And meanwhile, those with a continuity midwife who, according to the whistleblower, actually lower risk, are jumping ahead and delivering their babies because a midwife is available straight away. A system which is actually supposed to help reduce the rate of stillbirths and maternal mortality has, through its poor implementation, resulted in a two-tier system whereby high-risk pregnancies are made to wait for deliveries. For example, a woman in need of urgent caesarean section may have to wait while women with a planned or elective caesarean section are seen first. Also recently, the Health and Social Care Committee's evaluation of the government's progress against its policy commitments in the area of maternity services in England rated the government's continuity care commitment as inadequate and in need of improvement. Again, that's simply not good enough. Now, whilst figures also suggest that a number of women from disadvantaged backgrounds are likely to experience a high-risk pregnancy and who are now receiving continuity care, and that those numbers are increasing, it's clear that the government is not on track to meet the target of rolling out its continuity of carer service model to 75% of the most vulnerable groups by March 2024. Without this adequate funding and staffing, this two-tiered system that's played out in Worcester will continue. Other measures introduced by the government to improve maternity health care seem to ignore the racial disparities altogether. Now, on 4th of July this year, the Department for Health and Social Care announced it was committing $2.45 million to improve childbirth care. $2 million was to be allocated to test the best way to spot early warning signs of babies in distress, and the remaining was allocated to developing a new workforce planning tool for maternity medics, including helping trust to tackle other inequalities, taking into account local factors like birth rates, age population, the socioeconomic status of the area, and geographical factors. These are all important, but at no point in this announcement, despite all of the information we have heard over the past few years in particular, was there any reference at all to tackling ethnic disparities in maternal health care. Now, I would like to ask the Minister why the decision was made to omit a reference to ethnic disparities when research clearly highlights ethnicity as a factor in maternal health outcomes. So much so that a series of papers released in The Lancet regarded black ethnicity as a risk factor for miscarriage. In fact, the only other intervention I've heard has come from NICE, and that was to induce black women at 39 weeks. Another tone-deaf response. Now, there are loads of responses from throughout the sector which really drilled down what the problem was with this. Christina Ketchy, who's the co-chair of the Royal College of Obstetricians and Gynecologists, said that stratifying risk by race alone is a blunt tool. Although highlighting higher risk is important, it doesn't move our understanding further as to why this group of women is at greater risk. Women should always be able to make informed decisions about their own care based on real evidence. This suggestion was not based on real evidence. The Royal College of Midwives warned against a blanket approach recommendations in favour of personalised care, saying Black, Asian, mixed and ethnic minority women faced a constellation of biases when accessing maternity services, often experiencing poorer quality of care and lower satisfaction. Introducing an intervention that is singling out women on ethnicity alone, when there are likely to be large differences in health status and values within the group, could be in itself considered discriminatory. And Mars Lord, who is a doula and birth activist who started the campaign Not So Nice with her colleague Leah Lewin, said that the recommendations were already affecting black people's mental health. She said that she'd been in contact with dozens of black and brown pregnant women and birthing people who are fearful about their birth because they're not seeing any of the choices. And thousands have signed a petition to urge the government to reject this guidance from NICE. Because it's clear that without a proper plan to end racial maternity health disparities, the government is actually telling black, Asian and ethnic minority women and birthing people right across this country that it doesn't care, that our pregnancies, our children and our experiences do not matter. If the government want to show that this is not true, if they want to prove that they care about the experience of every pregnant woman, then they have to start first and foremost by setting a target to end these maternal health disparities. When the Minister responds today, I want to hear first and foremost that the government has set a target to end racial maternal health inequalities. I want to hear that the government has a time frame for when they would like to see these gaps close and reduced, and exactly how they plan to do this. And I want to hear the government has heard what black women have been saying about our experiences in maternal health care, and that this has often resulted in negative outcomes and traumatic experiences. I also want to hear the government acknowledge this and acknowledge that it will actually engage with black women to improve our experiences of maternal health services. And when the Minister responds, I hope to hear that the government will be implementing the Human Rights Select Committee's recommendations on black maternal health, as well as those included in the Health and Safety Select Committee's report, Safety of Maternity Services in England. And finally, when the Minister responds, I hope to hear that the government intends to launch an inquiry into institutional racism and racial bias within the NHS, as well as within the medical education field. Stereotypes about the pain, tolerance of black people, our cultural beliefs and practices, our perceived understanding of the medical system all contribute to the negative experiences black women have had in maternal services, and I know they've definitely contributed to mine. It's certainly an uncomfortable view to take that medicine or our fantastic NHS may operate within a framework that has institutional and racist bias. But if we're going to improve the maternal experiences and outcomes for black women, then we have to address the racial stereotypes that cause them. And we're not going to get there by burying our head in the sand and pretending that these racial injustices don't exist or that they're not so bad. The colour of a woman or a birthing person's skin should not impact the experience that they have of maternal health care services or their chances or a successful outcome, or, in fact, whether or not they live or die. But it's a sad fact that this happens in our country, in the 6th largest economy in the world, in one of the safest places to have a child. And so we're calling on the government to help improve these maternal experiences for all women. Thank you.
Ribeiro-Addy to sum up the debate.
Thank you very much, and I'll try not to take up too much time. I'm really pleased that we have been able to have such a full discussion this morning, and I know that many members across the House who would have wished to participate this morning but were unable to attend, and I take confidence in knowing that there are many members in the House who are committed to really reducing racial disparities in maternal health care. But I want to start by thanking the members that have contributed to today's debate, and my apologies for any mispronunciations of constituency names. But we'll start with a simple one, the member for Sisters of London and Westminster, and the honourable member for Romsey and Southampton North, very much so for pointing out how much black women do not feel listened to. And actually, the fact about socio-economic groups, I think that was very, very key. But also pointing out that because of racism that exists in our society, 70% of black people living in this country live in the poorest areas of this country, and that definitely has an impact. A member for Vauxhall, I want to thank her for sharing her experiences, and also to let her know, which I think will be of great encouragement to her, that the hospital where she had her 2 children, wonderful children, they're my mates, that they have, St Thomas's have actually undergone 5 times more training, and many of the midwives there have done that, and I think that's great. And there are other NHS trusts, like Croydon NHS trusts, who have actually put together a campaign called Heard, who are, meeting these needs and taking these steps and training in a gap where they haven't been asked to. So I think they should definitely be congratulated for that. My right honourable friend, the member for Hackney North and Stoke Newington, particularly for making the point that we cannot be blaming black women for the situations that they find themselves in, and sadly that is what happens. Regardless of confidence in education and socioeconomics, as you rightfully pointed out, this doesn't always change outcomes, something that the member for East Renfrewshire also pointed out. And of course, the member for Glasgow North East for very frank comments about race, and very, very articulate way of describing exactly what institutional racism is. If only we had that level of understanding right across the House, I believe that this country would be a different place. Now, I'd also like to thank the Minister for her response. Of course, congratulate her on the birth of her grandchild. I want to thank her for committing to ending racial disparities, and just to let her know that I do think that this new body sounds like a very, very positive thing. But I'm very, very concerned that despite this new body, despite what it's going to tackle, it's still not clear whether or not the government has understood that institutional racism is a serious factor affecting these outcomes, and a direct commitment to changing this, especially in the light of the race report. Yeah.
Mr. Chair, because I think we have time. So I probably should have mentioned also the Maternity Inequalities Oversight Board, which is due to meet again next week. So it's I didn't want to give the impression that the new office, which we're launching on October the 1st, would replace everything else that we're doing and all the other work we're doing. Maternity Inequalities Oversight Board still meets. And the question about how does it inform policy, what we're doing with the Board for Equalities and Disparities is working hand in hand. And as my friend knows, we also have the Patient Safety Board. I can assure her that at all meetings when we talk about maternal inequalities, that the situation, which is something which just has to be addressed and we have to turn around in whatever way we can, which is why the Office for Health Disparities has been established, we have to turn around the dreadful and appalling figures which pertain solely and uniquely to black women's experience of maternity. So I wanted to understand all the rest of the work is still going on, because this remains a focus within the department, which is why I urge her to keep calling her debates and to keep raising it as an issue, because that does help to drive things forward, and it does help to help us to develop policies that would be both acceptable and welcomed. And I thank her for recognising the work of the Disparities and Inequalities Board. It's just another tool that we put into the box to help fight what is a much bigger problem, and one that we have to solve.
Ribeiro-Addy.
Thank you very much, Minister. But my main point about that was, whilst the work is going to be ongoing, will it be ongoing with a recognition, given what's been said in the past, about institutional racism and how it's affecting our various bodies, no less the NHS, accepting that which we don't believe, and many don't believe has been done before, is very, very key to making sure that we get the outcomes that we need overall. Now, as many members will know, this topic is one which is particularly close to me, and it's not one that's always easy for me to talk about, and actually also many of those engaged in the campaign to end racial disparity in maternal health care experience the same thing. When we detail our past events and the experiences we've gone through, we don't do so to gain any sympathy. In fact, we do so to give a voice to the hundreds of black women each year who have similar experiences, and we do so in the hope that our stories will help to spur the change needed so that black women no longer face these negative outcomes and the negative treatment we so often face. Bringing children into this world shouldn't be a matter of life or death, and we have a duty here, particularly with what we are tasked to do every day in our work, to make sure that not just for the mothers that don't survive a dangerous birth experience, but for the many that actually go on to experience trauma in these. So I hope that the government has been spurred into action further. I'll continue to hold the minister's feet to the fire, since she sounds like she enjoys it, and I will call on the government to do a lot more. So just to sum those up, to ensure that we have proper data collection, and to ensure that we increase the support available for at-risk women, to implement the recommendations of the Human Rights Select Committee report, Black People, Racism and Human Rights, to identify those barriers to accessing maternal mental health care services and increasing accessibility of maternal health services after miscarriage and traumatic maternal experiences, to engage with black women in improving their experiences of maternal health services, and to commission a review of institutional racism and racial bias directly in the NHS and medical education, to address the learned stereotypes about black and ethnic minority women that impact us so much. I believe that by committing to these steps, the government can demonstrate that it's serious about tackling racial disparities. And you've heard me say it before, and I will say it again, that the colour of a woman or a birthing person's skin should not have an impact on their health or the health of their baby. But the sad reality is that in this country that it does. And whilst the government appear to hear and are making some headway, I really want them to listen. And I only believe that they have truly listened when we have those targets, when we have those very, very clear mechanisms to end institutional racism in our health service. Thank you.